Dear attendees, thank you for finding time to attend today's webinar. We are very happy to welcome Joe Porteus from Rapid Response. And so without further ado, let's welcome Joe. Joe, you may start.
Hello.
Now. Yeah.
Okay. Thank you very much, Wishan. Yes, good afternoon in Singapore time, everybody. My name is Joe Porteus of Rapid Response Revival. We've been to this fair a few times, I think 2 or 3 years ago, and Medica in Germany a couple of times. So this is obviously unique, and we're excited about how a virtual fair will work. And we're assuming this won't be the only way we do business in the future, but certainly we see it as something that will be part of how we actually communicate with each other across the world. So firstly, I've got 15 minutes to talk with you today. What we're going to talk about is our defibrillation device. If Wishan, you could move to the next slide. In particular, AEDs. So we're in the business of sudden cardiac arrest and defibrillation. So if we go to the next slide, I'll give you a bit on our story, which is obviously very important. And with our mission and our purpose for being is to solve the unacceptably high sudden cardiac arrest death rate. So approximately 1 every 5.5 seconds, someone suffers sudden cardiac arrest in the world. So since I've been speaking, that's many people in the world are having a sudden cardiac arrest, and it's one of the biggest killers. 80% of sudden cardiac arrest happens in the home. So that's 80%. That's a lot of mum and dads and a lot of people we know and loved ones. I'm yet to meet very few people in all my travels across the world who haven't been impacted in some way by sudden cardiac arrest. Our purpose is to unite. We have a device, of course, but involved in solving sudden cardiac arrest is training and government, schools, medical professionals, responders, and of course training the community overall. There's a lot of well-meaning people and a lot of people on trying to solve this, sometimes in their own way, in their own pocket of the world, and sometimes with the university. We'd like to unite that tribe and move forward and, of course, help solve this global problem. Thanks, Wishan. We started as a bit of our story. We've probably got a different one. There is our founder, Donovan Casey. 6 years ago, his wife had a sudden cardiac arrest at home. And after 15 minutes he is lucky that he is trained in CPR, which I encourage everyone to do. So he knew how to do compressions and chest compressions. He managed to call the ambulance in a moment of high panic, as you can imagine, with your wife lying prone, making chicken sounds on the floor. In high panic, he did CPR, called the ambulance, which took 14 minutes to arrive, and she miraculously survived. He, being the innovator and completely disruptive mind that he is, he said if 80% of sudden cardiac arrest occur in a home, then why isn't there a defibrillator on every refrigerator? And so with that, 6 years ago, we started our journey to look at bringing what is usually a medical device. How can we bring that into the community at large, which is our mission? So what do we have to do? What do we have to do to disrupt this market to make it easier and bring it on every refrigerator in the world? So I mentioned briefly the problem. So, and we can have a look at the videos. There's some very good videos on our website, and I'm happy to share more on the story about what everybody can do. But here is the actual problem that we face. Now, we're aware that defibrillation works, but if you have a look, the chance of survival starts at over 90%. You see the chart as it goes downwards, starts at 90% if defibrillation happens in the first 2 minutes. And if you look as the chart disappears into darkness on the right-hand side, we're down to a chance of survival of less than 10% over the next, after 11 minutes. That's 10% after 11 minutes. And even I have been talking for nearly 6 or 7 minutes, and in that time, which has gone very quickly, you can see the chance of survival plummets. So we're down to about a 50% chance of survival only during my presentation time alone, and decreasing very quickly. Of course, one of the issues that we face here is that the average ambulance time for an ambulance to respond to someone in sudden cardiac arrest, considering most of the world lives in large cities, and we've all, and I'm sure all of us have got our own traffic issues and traffic problems and expressway problems, that getting an ambulance in under 11 minutes is actually just the average. So it can be much longer than 11 minutes, which means the chance of survival is under 5%. So there's a lot of ambulance, there's a lot of distress in families, there's a lot of wasted emergency responder time travelling to lost causes. Of course, if even at 6 or 7 minutes, that means a long time in hospital as well. So there's a long recovery time. So the cost to the overall economy and the cost of the health system of having sudden cardiac arrest patients taking longer to recover is also something that rolls into the entire problem, as well as, of course, losing loved ones. Thanks, Wisham. So here is also what a traditional AED looks like. There have been many very well-meaning governments of putting public access defibrillation. You may see the cabinets in your shopping centre, certainly in Changi Airport, should we be in Singapore, but certainly around, there are many different styles and many different approaches, and government has just determined in many areas that by putting lots of access there, it'll actually solve the problem. Now, one of the issues, of course, is they're all completely different devices and take training. I myself, as a typical Australian, am a surf lifesaver and have been for 10 years, which means I'm trained annually in defibrillation and CPR. I work on the beach with drowning. And even after my 10 years, some people think I should be very experienced. I am still nervous if I see a device that I do not know how to use. So if I'm trained on one in the surf club, when I go to the supermarket and people expect me to jump forward, it is actually a mild panic that in moments of high pressure, is how do I use this device? What do I have to do in those moments, considering the critical minutes that we just talked about? Thanks, Wisham. So the solution, obviously, we see is to have a device. The first link, obviously we still need the ambulance service, but it's those critical minutes that having defibrillation available. Of course, what we also want to inspire is training. So people able to act, responders and bystanders, confident to act in the moment, and confidence comes through training, of course. Confidence also comes through having access to a device that's easier to use and perhaps portable. So the hand movements are second nature. And a lot of bystanders just don't know what to do when we lose those minutes. So there are studies there, of course, which we can point to on our website to back up all of these statistics. And there's many universities working on this exact same thing all over the world. So next slide, please, Wisham. So what we have come up with is a device that's about the size of a large iPhone. Originally, we called it CellAid because we thought maybe we could get enough power from the battery of an iPhone to give a charge, so strap it onto the battery. That is still our vision, by the way, but we're a few years away in battery technology. The idea is to have something affordable, so we want to come around the $250 mark or below. Personal, so we can carry it, and obviously portable. So if this can fit in the glove box, this can fit in the boat, in the car, in the backpack, and be carried very quickly around, even in the cycling group. And the light weight makes it easy to take around with you. So affordability, and of course, one of the key things here is the usability. You'll see in the red there is something called snap, peel, stick. We believe that those three words are the key. This device, if you can see here, you snap it in half, you peel away the sticker, and as you can see on the third point, we actually place it on the bare chest. snap, peel, stick, and the practicing of those movements. I haven't put a video up here, but I'm happy to show you. Doing that, having those 3 words in your mind in that high pressure moment will actually help us. So thanks, we can move on. Obviously, this is how we see it in the office at the front door. It will be as ubiquitous as the fire extinguisher. At a hotel, you know it's near the lift, it's near the fire extinguisher. That is the perfect place to have the CellAid. Thank you. Probably the keys to us is it's single use. So reducing the cost and bringing the cost way down from somewhere over $1,000 or sometimes $1,500 into a single use device. So we figure you only need it once. So it sticks to the patient. It's IoT, so there's a GPS chip. So as soon as you snap the device, that will send your GPS location to emergency services in countries where we have that configured, and so the ambulance will know this is coming from a CellAid snap, and can send emergency to that spot. It will record the arrhythmia, of course, obeying all privacy laws that go along with that piece. It will stick to the patient, and with a single-use device, it's a way of keeping that down. We figure you only need it once. Of course, part of our philosophy is that if you've saved your parent's life or your neighbour's life, that we will send you a new one anyway, because we want to reward great responders and people who are saving lives in the world. Of course, in the future, from a business perspective, we see this as a natural subscription model, where for $10 a month or to $10 to $15 a month, when we get there in a few years, you can have permanent access to this. As the battery runs out, we will send you a new one. And we know when that's happening, as the once a month we collect the data and we can see the battery charge. So we can manage the assets for you, or if you're a business, we can also manage the battery life through a common portal. So that is incredibly important, having IoT coverage. We'll jump through again, thanks. And something I do want to talk about, obviously, is the trainer, something we've just released, which is not a medical device. And this is something we want to get for around $50, is a simple, even toy-like trainer where we can practice at home with our kids how to snap, peel, stick, put it on. It comes with an app that takes you through scenarios. It's not a real device and doesn't have any shocking capabilities, but it gets those hand movements, the snapping, the peeling and the sticking, removing the clothes, also very important to understand, and also important culturally, that the clothes must come off, and to actually apply the pads and the snap, peel, stick and the movement. The more we practice and have those hand movements down pat, when we're under that pressure and we have to perform in the moment, that's one thing we don't have to worry about. So we see the trainer as something, and it's different. You don't need to have the CellAid. It's even a way of using through school education systems, community education, and it reusable, of course, so, but at a much cheaper price. So obviously we want to help get people snap, peeling, sticking, but also to get people comfortable with a defibrillator. And that is actually one of the blocks. And as I mentioned in surf lifesaving, I don't get enough time with my hands on a defib to be comfortable in the moment. So thank you, and we'll be shown. So look, that's a very brief overview in 14 and a half minutes. Our key is, look, please come by. There's an email there, hello@cellaid.info. That's hello.cellaid.info. Please drop me a line. My name is Joe Porteus. You can come by our booth, of course, and request a meeting. And we'd love to get your details no matter what. If you have commercial opportunities here, country opportunities, investors, of course. So we're looking to IPO within the next 12 months in Australia. So there are investment opportunities as well. And of course, if you just really want to solve sudden cardiac arrest and join us on the mission, we'd love to have a conversation with you. So thank you all for listening, and I will hand back to my charming host, Wee Shah.
Thank you, Joe. Thank you so much for this wonderful presentation. So if you have any questions, you can always drop Joe an email, or you can find him via the business matching service that's available on our Jumia platform. So without further ado, let's thank Joe again, and we'll see you soon, Joe.
Okay, thank you very much.